3M VAC Veraflo dressing kits are specifically designed for use with Veraflo therapy. The foam is less hydrophobic than the 3M VAC Granufoam dressings, which helps facilitate even distribution of topical wound solutions. VAC Veraflo dressings also have increased tensile strength. VAC Veraflo dressings are available in small, medium, and large sizes to accommodate various wound sizes and minimize waste. The small and medium VAC Veraflo dressing kit includes spiral cut foam with perforation. The spiral cut foam is also useful for bridging and offloading techniques and ideal for use with a single pad application. The large 3M VAC Veraflo dressing kit includes 2 layers of oval shape block foam, ideal for wounds with large surface areas and shallow depths. In addition to the foam, the VAC Veraflo dressing kit includes 3M Cavalon No Sting Barrier Film, 3M VAC Ruler, and 3M VAC Advanced Drape. The small and medium dressing kits contain the 3M VAC Veratrac pad, an all-in-one system that incorporates tubing for fluid input and tubing for exudate and fluid removal through a single pad interface. The large VAC Veraflo dressing kit contains the 3M VAC Veratrac Duo tube set, which consists of 2 pads, the Instill pad for fluid installation and the SensorTrack pad for fluid and exudate removal. Before applying a new dressing, remove and discard the previous dressing per institution protocol. Thoroughly inspect the wound to ensure all pieces of dressing components have been removed. Ensure debridement of all necrotic, non-viable tissue, including bone, eschar, or hardened slough, as prescribed by the physician. Perform a thorough wound and peri-wound area cleaning per physician order or institution protocol prior to each dressing application. Protect fragile or friable peri-wound skin with medical-grade transparent film, skin protectant, or hydrocolloid. Make sure the skin is clean and thoroughly dry prior to applying the Cavalon No Sting Barrier Film. Use the wipe to apply a uniform coating of film over the desired area. Allow to dry thoroughly for a minimum of 90 seconds. This allows fluid to dry and vapors to dissipate. Assess the wound's dimensions and pathology, including the presence of undermining or tunnels. Do not place any foam dressing into blind or unexplored tunnels. A non-adherent material can be used prior to foam dressing placement in order to protect delicate structures, such as blood vessels, or to facilitate future dressing removal. Protect fragile or friable peri-wound skin with medical-grade transparent film, skin protectant, or hydrocolloid. Carefully tear or cut the foam to a size that will allow gentle placement into the wound without firm packing of the foam or overlapping onto intact skin. Gently place the foam into the wound cavity, ensuring contact with all wound surfaces. Do not force the foam into any areas of the wound. Trim the VAC Advanced Drape to cover the foam and an additional 3 to 5 cm border of intact peri-wound tissue. The VAC Advanced Drape may be cut into multiple pieces for easier handling. Carefully remove layer 1 to expose adhesive. Place the adhesive face down over the foam and apply the drape to cover the foam and intact skin, ensuring at least a 3 to 5 cm border of intact peri-wound tissue. Remove layer 2 and pat the drape to ensure an occlusive seal. Remove the ruler handling bars. Choose an appropriate location for the VAC Veratrac pad. Pinch the VAC Advanced Drape and carefully cut a 2.5 centimeter hole, not a slit, through it. The hole should be large enough to allow for removal of fluid and exudate. You do not need to cut into the foam. Next, remove both backing layers 1 and 2 from the pad to expose the adhesive. Place the pad opening directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. To apply the VAC Veratrac Duo tube set, choose the In-Still Pad application site. Pinch the VAC Advanced drape and carefully cut a 2.5 centimeter hole, not a slit, through it. The hole should be large enough to allow for removal of fluid and exudate. You do not need to cut into the foam. The In-Still Pad has a central disc and a surrounding outer adhesive skirt and the smaller diameter tube. To apply, remove both backing layers 1 and 2 to expose adhesive. Place pad opening in central disc directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. Now, choose the pad application site for the SensorTrack pad. Pinch the VAC Advanced drape and carefully cut a 2.5 centimeter hole, not a slit, through it. The hole should be large enough to allow for removal of fluid and exudate. You do not need to cut into the foam. Apply the SensorTrack pad. Remove both backing layers 1 and 2 to expose the adhesive. Place the pad opening in the central disc directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. You are now ready to connect the VAC Veraflo dressing to the VAC Alter Therapy System. Please watch the VAC Alter 4 Therapy System video for further instructions on initiating Veraflo therapy. Remember to keep therapy on for a minimum of 22 hours per day. Dressings should be changed every 48 to 72 hours, but no less than 3 times per week or as ordered by the clinician. For more product demos and application techniques, visit 3m.com/medical.